Hello everyone. See, this is iliac crest. This is iliac crest. This iliac crest's anterior more than anterior 3/4 part. The iliac crest more than anterior 3/4 part is known as ventral segment of iliac crest, and less than posterior 1/4 part is known as dorsal segment of iliac crest. Okay, see, this is iliac crest. So more than 3/4 of the anterior or ventral part is known as ventral segment of the iliac crest, and less than 1/4 of the posterior part is known as dorsal segment. Make out? See here, this is greater sciatic notch. This is greater sciatic notch, and this is lesser sciatic notch. See here, this is followed greater sciatic notch, and see here, let's follow it. This is lesser sciatic notch. So I'm just trying to explain how these two, greater and lesser sciatic notch, get converted into foramen. Okay, if we see here, this is sacrum. Okay, so this ligament is coming from sacrum to to ischial tuberosity. To this bone is ischium. You see, this is ischium. This is ischial tuberosity. Last class I discussed with you all know hamstring muscles. So all the hamstring muscles arise from ischial tuberosity. Okay, so see, this ligament is coming from sacrum. It got blurred. This ligament is coming from sacrum to ischial tuberosity. Here you can make out this ligament is coming from sacrum to ischial tuberosity. So this ligament is known as sacrotuberous ligament. Why sacrotuberous? Because it's coming from sacrum and getting attached to ischial tuberosity. So the name of this ligament is sacrotuberous ligament. And see here, this is the spinous process of hip bone. This is the spinous process of hip bone. See this ligament, it's coming from sacrum to the spinous process of hip bone. Can make out clearly? Because sacrotuberous ligament lies posterior to this sacrospinous ligament. So sacrospinous ligament lies ventral to sacrotuberous. So you can make out properly. So this ligament is extending from sacrum to spinous process of hip bone. So the name of this ligament is, just follow it, sacrospinous ligament. See here, sacrospinous ligament, and this is sacrotuberous ligament coming from sacrum to ischial tuberosity. Okay, so now you see this open space of greater sciatic notch has got converted into a closed space, and now it will be called as, see here, greater sciatic foramen. Greater sciatic foramen, because it was an open space, now it is closed from all the sides, so it became a closed space, that is foramen. This was lesser sciatic notch. It was open space. Now because of these two, sacrospinous and sacrotuberous ligament has converted this open space of lesser sciatic notch into a foramen, closed space. So now you see this lesser sciatic foramen. So these two ligaments, sacrotuberous and sacrospinous ligament, convert these greater and lesser sciatic notches into greater and lesser sciatic foramen, and so many structures pass through this foramen, we will see further. One more thing I wanted to explain to you all was, see here, this is erector spinae muscle. These three muscles together are called as erector spinae muscle. See, iliocostalis muscle, then longissimus muscle, and then spinalis muscle. This is spinalis, this is longissimus, and this is iliocostalis muscle. These three muscles together are known as erector spinae muscle. So the aponeurosis I've already explained is the flattened tendon of any muscle is known as aponeurosis. So the erector spinae muscle together or these three muscles separately, you can say the flat, see these three muscles are coming from, see, below upwards. They are covering the entire length of the spine, vertebral column. So the flattened tendon of these three muscles, what do? They keep the spines of these vertebrae erect. It doesn't these aponeurosis doesn't allow our spine to bend forward. Okay, they keep the spines of these vertebrae erect. That's what all these three muscles together are called as erector spinae. It means they keep the spine erect. They keep all the spines of the vertebrae erect. That's what is erector spinae muscle. So one of the points of origin of gluteus maximus is the aponeurosis of erector, the lower part, aponeurosis of the erector spinae muscle. Right? That's what I wanted to explain. And see here, this rough bony ridge. See here, is known as gluteal tuberosity. Is known as gluteal tuberosity. Right over the posterior surface, lateral part, posterior surface. Okay, so this is gluteal tuberosity. 1/4 part of gluteus maximus is attached to this, and the major 3/4 part is attached to the above upper part of iliotibial tract, which splits into two laminae, the superficial and deep laminae. So this is gluteal tuberosity. Okay, now you see this is greater trochanter of femur. Greater trochanter of femur. Okay, one oblique ridge on this, and then here you see this is greater trochanter. Here also. Okay, and this is lesser trochanter. Here you can make out this is lesser trochanter. So greater trochanter and lesser trochanter. In between you have intertrochanteric. See here, in between these two, over the ventral surface. Over the ventral surface you have intertrochanteric line over the anterior surface, and posterior surface you have intertrochanteric crest. This is in the form of a crest. See here, intertrochanteric crest, and here you have a space known as trochanteric fossa. Okay, this is pectineal line coming downwards, and this is linea aspera. See here.